Greetings to all the incredible people at UMCC Medical Consultant Connectors. Here, your health isn't just a priority, it's our passion. Today we're taking a deep dive into the subject of antepartum hemorrhage. Don't worry if medical jargon isn't your first language. We'll make sure this is a journey everyone can embark on. We believe in breaking down complex medical topics, making them accessible and understandable for all. So, buckle up as we dive into the world of antepartum hemorrhage. First things first, what exactly is antepartum hemorrhage? Let's break it down in a way that's easy to grasp. Antepartum hemorrhage, or APH, refers to bleeding from or into the genital tract, occurring after the 20th week of pregnancy and before the birth of the baby. Imagine it this way. The mother's womb is like a nurturing garden, and the baby is like a growing plant. Sometimes, due to various reasons, this garden experiences a sudden downpour, which in medical terms we refer to as hemorrhage. This downpour, or bleeding, can pose significant risks to both the mother and the baby, hence the importance of understanding and managing this condition. APH is a common complication in pregnancy, but don't let that alarm you. With the right knowledge and care, it can be effectively managed. Now that we know what antepartum hemorrhage is, it's time to understand why it happens. So, what causes antepartum hemorrhage? Antepartum hemorrhage, or bleeding during pregnancy, can be a result of various conditions. Two of the most common causes are placenta previa and placental abruption. Placenta previa is a condition where the placenta, the organ that provides nourishment to the fetus, covers the cervix either partially or completely. This abnormal positioning can cause bleeding, especially during the third trimester. The bleeding is usually painless, but can be heavy and pose a risk to both mother and baby. Placental abruption, on the other hand, is when the placenta separates from the inner wall of the uterus before birth. This separation can lead to bleeding and deprive the baby of oxygen and nutrients. It can also cause discomfort and pain in the mother. Other less common causes include vasa previa, where fetal blood vessels cross or run near the internal opening of the cervix, and uterine rupture, a rare but serious event where the uterus tears during pregnancy. Infections in the uterus, trauma to the abdomen, or a history of antepartum hemorrhage in previous pregnancies can also increase the risk of this condition. Understanding these causes is a significant step in preventing and managing antepartum hemorrhage. It empowers us to be vigilant and proactive, ensuring the best possible outcomes for mother and baby. There's a saying that prevention is better than cure. So how can we prevent antepartum hemorrhage? In order to prevent antepartum hemorrhage, one of the most crucial steps is regular prenatal checkups. These checkups help in early detection of any risk factors or complications that could lead to bleeding during pregnancy. By keeping a close eye on your health and the health of your unborn baby, you can take proactive steps to manage any potential risks. But what if antepartum hemorrhage does occur? What then? The first and most important step is to get immediate medical attention. Time is of the essence in these situations. The faster you get help, the better the outcome for both mother and baby. In some cases, a cesarean section or C-section may be required to deliver the baby safely. This is usually considered when the bleeding is severe, or if the placenta is covering the cervix, a condition known as placenta previa. Additionally, blood transfusions may be necessary if the hemorrhage has led to a significant loss of blood. This can help to replenish the body's blood supply and stabilize the mother's condition. Remember, it's crucial to keep open lines of communication with your healthcare provider throughout your pregnancy. This can play a key role in preventing and managing antepartum hemorrhage. With the right knowledge and timely actions, we can significantly reduce the risks associated with antepartum hemorrhage. We've journeyed through the world of antepartum hemorrhage, and we hope this knowledge empowers you. Remember, understanding this condition, its causes, and its prevention and management strategies is crucial in the medical field. It's not just about the knowledge, but about how we use it to make a difference. So let's continue to learn and grow together. Before you go, don't forget to click on the like, subscribe, and share buttons. Help us spread this important information to more people. After all, knowledge is power.